Hello, Eng-Kong. Welcome back to the second short video that we are preparing together for prospective students who might want to hear a little more about how our existing, very experienced trainers and practitioners are using Buddhism in their work as therapists. So my second question to you, how is Buddhism influencing your work as a psychiatrist?
Thank you, Sabina. This is quite a searching question, and I've often reflected on this. And it was with a lot of forethought before I decided to, with a team of senior colleagues, start this organization, this Australian Association of Buddhist Psychotherapists. And then, in a sense, for many of us to come out of the closet, to declare ourselves as Buddhist psychiatrists or Buddhist counselors or Buddhist psychotherapists, and so on. And then when we do so, actually our client population changes because we are now known with a different or additional label, so to speak. Mm-hmm. And just by that process, some people also will not see us because we are known now as spiritually oriented or Buddhist influence. And as we produce this professional training course, the team of us, and including yourself now, Sabina, in this 5th training course, helping us to keep on improving our course, including new teachers and gleaning from new books. Every month or so, there are more and more books on Buddhist psychotherapy and related areas, and more research findings on the different aspects of the Buddhist teachings that now are evidence-based. As we incorporate all this, my work and a lot of the work of Buddhist counselors and psychiatrists were more and more influenced. And in fact, I have to admit, and I'm glad to say, that more than 50% of my work as initially a medical doctor and then a psychiatrist and then an analytic psychotherapist, and now a Buddhist psychotherapist. More than 50% of my work now, I come from my mind, my heart, and my body states from that contemplative tradition of Buddhism. So it's almost taken over my whole being as a psychiatrist, and I've stopped being a general psychiatrist more than 30 years ago now. I've been practicing now for 44 years. From being a general psychiatrist, I went into psychotherapies, and from psychotherapies, I had a tendency and I vibrated, and now I'm practicing more as an analytically oriented psychotherapist. And then now I'm a Buddhist analytic psychotherapist. And Buddhist teachings has influenced me in a thorough way. It has transformed me. And most of our students graduating from our course, as you know, one of the regular words that they use at the end of one of their 10 teaching modules, or at the end of one of the 3 retreats, and certainly at the end of the 2-year course, they say they are transformed. I'm transformed, and I'm still in the transformation process. Mm-hmm. As I attend more and more retreats, as I study, read, practice Buddhism more and more, in a way, that heals in a way that helps a fellow human being. So I'm so influenced in so many ways. To particularize it in certain areas, if I may, Buddhism has helped me to understand and, in a sense, to demedicalize, to depathologize, and to actually help to understand that it's actually normal. So many aspects of our human condition, so many suffering aspects of our human condition that we share with our clients, our patients, because we're all in this earthly, worldly existence, in Buddhist terms, in samsara. Um, it, it, it is because we have brought it into the medical world, perhaps first by Sigmund Freud and his colleagues, that we brought in the psychological, emotional suffering into the professional health field. But once you do that, that kind of, psychiatry practices at a biological, social, psychological level. These are the three parts. So when I went on to specialize in the psychosocial and I left the biological, the psychosocial, when brought into the health field, then you have to study it and present it scientifically. And then you have to give them labels of diseases and disorders. And to some extent, it is giving a label necessarily so that there's a way of classifying and understanding through research, scientific research, to give almost a bona fide standing for treatment. To start with medications and then realizing that in many sufferings, medication is not the way to go. Often it's useful, but we need more than medications. And then when we come to the psychological, emotional area, we then actually also have to understand it's a range, it's a spectrum. When does sadness becomes depression? When does depression become despair? So when a Buddhist psychotherapy helps us to understand and normalize. It's quite normal that in this pandemic period, we're all anxious. We're all in anxiety states. But that doesn't necessarily mean we need to have an anti-anxiety medication, nor does it mean we have to straight away go and see a psychiatrist or a senior psychologist for treatment. When we understand that this is normal given this situation, we can still get help from counselors, from therapists, from a good friend, from a senior colleague, and from the temples and the churches, places where our teachers can offer us a sympathetic, compassionate, listening ear. So Buddhism has also increased my range of skills and techniques. And in particular, the obvious one is now we have so many mindfulness-based approaches. And all of them are research, and the findings are so encouraging. So, in fact, I'm now much less, and now in social events, I've stopped introducing myself as a psychiatrist. I call myself a psychotherapist if people ask me what's my profession. I'm so much now more analytic. So in my mindfulness analytic approach, which includes inquiring in a mindful way. And in the therapy I offer, in the medicine that I offer, it is, a lot of it is the medicine from the Buddha. And in that sense, the Buddha was one of our world's greatest physicians, as we would call him today. So I am better equipped as a Buddhist influence or spiritually influenced psychotherapist, especially for deeper, longer-term work, and especially for, in the past, when I was a bit shy to bring in more directly mindfulness techniques, and let alone mention the word spirituality or Buddhism. I used to be quite, shall I say, feeling disappointed and feeling there's something still missing in the way I help others. But now that I bring in Buddhist teachings and practices, often without mentioning the label, the word Buddhism, I'm better equipped, and I get more job satisfaction helping the more difficult and seemingly impossible cases. I'm not saying that I found the miracle cure. Far from it. I still do accept that there are many cases, and it is part of the human condition that whatever therapy is available today doesn't fix everybody and doesn't fix everybody completely. Even Sigmund Freud has admitted from the start, psychoanalysis at best is to help the person to be able to live a life that they can work and play, but that is still the common misery. And the Buddha said the same thing. The Buddha said that there are three types of dukkha, three types of suffering. And the third type of suffering, the third dukkha, is the dukkha of existence. That as long as we exist in this human condition, we have to suffer, and we have to accept some degree of suffering. That in that sense is beyond medications, beyond conventional treatments, and requires the spiritual dimension for us to accept such as such.
Thank you. Gee, what a rich summary of how you are influenced, informed, and shaped by the teachings of Buddha. So thank you so much, Eng-Kong, and really appreciate your time. And I know we have a third question lined up. So the third video will be about what are your top 3 reasons to sign up for anyone considering the AABCAP 2-year training. So why do you suggest for people, for therapists who are experienced practitioners, to sign up for the 2-year training course? So I say thank you for now, and I'll see you again in a minute.
Thank you.